Bone snaps sound differently depending on a patient's age. Naraly knew this intimately. She didn't coddle or hold hands. When a screaming man was wheeled into Trauma Room 3 with his leg twisted backward, she didn't reach for morphine. She reached for a heavy pair of pliers. The fluorescent lights in St. Jude's emergency department didn't hum. They rattled a grating vibration that settled behind the eyes for the entire shift. Standing at the nurse's station, Naraly peeled dried iodine off her knuckles. Her once navy scrubs had faded to bruised plum, permanently smelling of bleach and stale sweat. A monitor down the hall shrieked a tachycardic warning. Nobody ran. Panic was a luxury reserved for medical students. Bed 4 is throwing up again, Clara whined from the desk. Naraly didn't look up from her jagged charting. Give him a basin, Clara. If he misses, hand him a mop. He says he needs a doctor. He drank half a gallon of cheap antifreeze. He needs a priest, but we're fresh out. Basin. Dropping the chart, she swallowed a cup of cold coffee that tasted like copper and burned beans. 14 hours into a 12-hour shift, her lower back throbbed in sync with her erratic heartbeat. Suddenly, the ambulance bay doors slammed open. The squeal of stretcher wheels cut through the ER's low murmur. 2 sweating paramedics leaned hard into a gurney. "Trauma 3, one shouted. Naraly tossed her coffee and snapped fresh nitrile gloves over her wrists with a sharp crack. The patient was a 52-year-old construction worker named Miller. He was screaming gutturally. A steel I-beam had crushed his lower right leg, leaving his heavy work boot pointing at a grotesque angle. His jeans were soaked in dark, arterial blood. Dr. Aaron Reed walked in a moment later, smelling of expensive sandalwood soap. Terrified of liability lawsuits, he treated the chaotic emergency room exactly like a courtroom. "Push 2 milligrams of Dilaudid," Aaron ordered, keeping his distance from the bed. "Let's get portable X-ray down here. Do not touch that leg until we know exactly what's fractured." Naraly ignored the command and checked Miller's foot. The skin above the boot collar was a sickly, translucent white. She pressed her thumbs against the top of his foot. "Nothing. No pulse. Dorsalis pedis pulse is gone, Aaron," Naraly said flatly. "The bone is tenting the artery. If we wait 20 minutes for X-ray, he loses the foot." Aaron adjusted his glasses. "We don't know the extent of the comminution. If you manipulate it, you could sever the artery completely. Wait for X-ray." Miller shrieked as a wave of agony hit him. His rough, calloused hands clawed at the thin bedsheets, ripping the cheap fabric. Naraly looked at Aaron. She looked at the white foot. Then, she walked over to the trauma cart. She didn't grab a scalpel or a syringe. She pulled out a heavy pair of metal pliers, kept in the bottom drawer for removing stubborn orthopedic pins. "What are you doing?" Aaron snapped. Naraly didn't answer. She walked back to the bed. "Hold his hips," she barked at the paramedic. "Naraly, I am giving you a direct order." Naraly clamped the pliers onto the steel toe of Miller's boot. She locked her elbows, braced her hip against the metal rail of the gurney, and yanked. The boot slid off with a wet, sucking sound, hitting the floor with a heavy thud. Before Aaron could yell again, Naraly dropped the pliers. She placed her left hand firmly on Miller's knee, her right hand gripping his heel. She didn't count to 3. She didn't offer a soothing word. She leaned back with her entire body weight, twisting and pulling in one violent, fluid motion. Crunch. The sound was loud enough to echo over the beeping monitors. Miller gasped, his eyes rolling back into his head as he passed out from the massive pain spike. Aaron stood, paralyzed, his mouth slightly open. You just... Naraly stared at the monitor. Miller's heart rate spiked, then began to settle. She moved her thumbs back to the top of his foot. Slowly, a faint, rhythmic thumping returned beneath her fingertips. The stark white of the skin began to flush with a splotchy, bruised pink. "Pulse is back," Naraly said, her voice completely devoid of adrenaline. She stripped her gloves off and tossed them into the biohazard bin. "You can call X-ray now, doctor." Aaron's face flushed a deep, furious red. You are a registered nurse. You are not a surgeon. You just performed an unauthorized, closed reduction. If you had paralyzed him, if I hadn't, he'd be buying one shoe for the rest of his life. Naraly walked past him, bumping his shoulder slightly. Write me up, Aaron. Just spell my name right. She pushed through the curtain, leaving him stammering in the sterile, unblinking light. The break room at St. Jude's smelled of rotting bananas and burnt microwave popcorn. Naraly sat alone in the corner, staring at a brown water stain on the ceiling tiles. She rubbed her left wrist. Beneath the fabric of her scrub top, a thick, jagged scar wrapped around her forearm like a bracelet. It was aching today. It always ached when the weather turned, or when she did something reckless, like insubordination. She knew Aaron would report her. She knew the nursing board would drag her in. It wouldn't be the first time. The problem wasn't that she didn't care about the rules. It was that the rules felt so incredibly small compared to the smell of dying tissue. St. Jude's was a decaying hospital in a decaying city. People here didn't have the luxury of waiting for pristine, textbook medicine. The intercom crackled overhead, cutting through her exhaustion. Code trauma, Bay 1. Code trauma, Bay 1. ETA, 2 minutes. Naraly stood up. Her knees popped. She threw her empty paper cup into the trash and walked back out into the bright, grating chaos of the ER. When the paramedics rolled Toby Carmichael through the doors, the smell hit the room first. It was the thick, metallic stench of massive blood loss mixed with engine grease and pulverized brick. Toby was 19. He worked at the old auto parts plant on the east side. A hydraulic lift had failed. Toby wasn't screaming. That was the first bad sign. He was thrashing weakly, his eyes wide and unseeing, his lips a terrifying shade of blue. Crush injury to the chest, the lead paramedic barked, breathless. Oxygen saturation dropping fast. Heart rate is 140 and thready. Breath sounds absent on the right side. Aaron was already in the room, his hands trembling slightly as he pulled on sterile gloves. Tension pneumothorax, he said, his voice an octave too high. The pressure is crushing his heart. We need a chest tube, now. Naraly moved to the opposite side of the bed. She began cutting Toby's greasy, blood-soaked shirt away with heavy trauma shears. The fabric parted to reveal a chest wall that was bruised black and purple. The right side of his chest was visibly swollen, hyper-expanded with trapped air. Kit, Aaron demanded, holding out his hand. Clara, the younger nurse, fumbled with the sterile packaging of the chest tube tray. She dropped it on the Mayo stand. The plastic wrap tore unevenly. Aaron grabbed the scalpel. Toby's back arched off the bed. A terrible, wet gurgling sound came from his throat. The heart monitor began to beep in a slow, erratic rhythm. Bradycardia. He was arresting. His trachea is deviating, Naraly said sharply, pointing to the kid's throat. The cartilage of his windpipe was physically being pushed to the left by the massive pressure building in his right lung cavity. He has seconds, Aaron. Decompress him. Aaron pressed the scalpel to the skin between Toby's ribs, but his hand was shaking. He looked at the bruised, distorted anatomy. He hesitated. The landmarks are obscured by the swelling. If I go in blind, I could hit the liver. I need ultrasound. We don't have time for ultrasound, Naraly yelled. The monitor's beeping, slowed further. Beep, beep. I can't just stab him, Aaron yelled back, paralyzed by the sheer messy reality of the flesh in front of him. Toby's eyes rolled back. The monitor flatlined. A solid, continuous tone pierced the room. Naraly didn't think. The rational, rule-following part of her brain had died a long time ago. She lunged across the bed. She grabbed a massive 14-gauge 4-needle from the supply cart, the kind used for rapid blood transfusions. She ripped the plastic cap off with her teeth and spat it onto the floor. Naraly, step back, Aaron screamed. Naraly found the second intercostal space on Toby's chest entirely by feel, digging her thumb hard into the bruised muscle. She didn't use iodine. She didn't wait for Aaron. She slammed the thick needle directly through the chest wall. Hiss! It sounded like a punctured tire. A massive rush of trapped air exploded out of the plastic hub of the needle, spraying a fine mist of blood onto Aaron's pristine white coat. Instantly, Toby's chest deflated. The pressure released. Naraly dropped the needle and immediately began chest compressions, slamming her palms into Toby's sternum. "Push 1 milligram of epi!" she barked at Clara, who was staring in open-mouthed horror. "Do it now." Clara snapped out of it and pushed the drug into the IV line. Naraly pumped. 1, 2, 3, 4. Her shoulders burned. She felt the grim grind of fractured ribs beneath her hands. "Come on, kid," she thought. "Don't do this here." 10 seconds later, the monitor spiked. A heartbeat, then another, then a steady, racing rhythm. Toby gasped, coughing up a spray of pink froth, his eyes fluttering open in pure panic. Naraly stopped compressions, her chest heaving. She looked up at Aaron. Aaron was staring at his coat, at the flecks of blood on his sleeves. He looked at Naraly, his expression twisted into a mixture of absolute awe and violent disgust. "You just assaulted a patient," Aaron whispered, his voice shaking with rage. "You used a non-sterile, improvised instrument. You bypassed the attending physician." "I kept him breathing," Naraly said, wiping a smear of blood off her forehead with the back of her wrist. "Now put the actual chest tube in, doctor, before the hole closes." She turned her back on him and walked out of the trauma bay. Her hands were shaking now, not from fear, but from the massive adrenaline crash. It was a familiar, ugly feeling. She retreated to the clean supply closet down the hall. It was the only place in the ER without a camera. She shut the heavy wooden door, plunging herself into the quiet, dim space, surrounded by stacks of sterile gauze and saline bags. She leaned her back against the door and slid down to the floor, pulling her knees to her chest. She closed her eyes. Her breath shuddered out of her in a jagged sigh. She pressed the palm of her right hand against her scarred left forearm, squeezing tight enough to bruise. The hospital bureaucracy was going to devour her for this. Aaron wasn't going to let it go. Her license would be suspended by Friday. So what, she thought. Let them take it. A sharp knock on the door made her flinch. Narrowly, it was Clara. The young nurse's voice trembled through the wood. "Naraly, you need to come out." Naraly wiped her face, schooling her features into a mask of bored annoyance. She stood up, smoothing her scrubs, and pulled the door open. "What is it, Clara? Did Aaron finally faint?" Clara looked pale. She was wringing her hands, a nervous habit that usually drove Naraly insane. "No, the police are here. They brought in a John Doe. Multiple gunshot wounds. They need you in Bay 4. "Why me?" Naraly asked, grabbing a fresh pair of gloves from her pocket. "Where's Aaron?" "Aaron is with him," Clara said, her eyes wide. "But the patient, he won't let anyone touch him. He has a gun, Naraly. He took it off one of the cops." Naraly stopped walking. "What?" "He's holding the gun to Aaron's chest. And," Clara swallowed hard, "and he's asking for you." Naraly frowned, cold dread pooling in her stomach. "He asked for a nurse?" "No," Clara whispered, stepping back as if Naraly herself were suddenly dangerous. "He asked for the butcher of Kandahar. He said he knows you're here." Naraly's blood ran completely cold. The buzzing of the fluorescent lights suddenly felt deafening. She looked down at her hands, at the faint, white scar tissue wrapping around her wrist. Nobody had called her that in 10 years. Footsteps echoed too loudly in the sudden, suffocating quiet of the corridor. Naraly walked slowly toward Trauma Bay 4, her rubber-soled clogs squeaking against the polished linoleum. A perimeter of police officers crouched behind overturned supply carts and structural pillars, their weapons drawn, their faces pale under the fluorescent glare. The air in the hallway was thick. It smelled of ozone, burnt sulfur from a discharged weapon, and the sharp, sour tang of unadulterated fear. "Stop right there, nurse," a uniform hissed from behind a crash cart, reaching out to grab her scrub top. "He's agitated. He already clipped one of my guys in the shoulder." Naraly batted the cop's hand away with a violent swat. "He asked for me. If you breach that room with guns drawn, he will pull the trigger, and my doctor will die. Stand down." She didn't wait for permission. She pushed through the heavy glass doors of Bay 4. The room was a mess of shattered sterile vials and upended trays. In the center, backed into the corner near the oxygen hookups, stood Aaron. His pristine white coat was smeared with a mixture of his own terrified sweat and the heavy, dark fluids of the man leaning entirely against him. The man was massive, dressed in a tactical vest that had been partially shredded by buckshot. His left leg was useless, dragging heavily on the floor, leaving a thick, wet trail across the tiles. In his right hand, a police issue. Glock 19 was pressed firmly under Aaron's jaw. Aaron's eyes were wide, unblinking, tracking narrowly with the desperate, mute plea of a trapped animal. "Took your time, Scott," the man rasped. His voice was a wet gravel drag. He coughed, and a fine spray of crimson dotted Aaron's collar. Naraly stopped 10 feet away. She didn't raise her hands. She just stared at the scarred, graying face of the man holding her attending physician hostage. It took her 3 seconds to strip away the 10 years of aging, the deep lines of pain, and the gray hair. "Elias," Naraly said. Her voice was perfectly flat, betraying none of the cold terror pooling in her gut. "Sergeant Elias Briggs, 1st Recon." The man who had carried 2 severed limbs in his rucksack for 3 miles in the Helmand province, just so his point man could be buried whole. "They told me you were dead, Naraly," Elias wheezed. His hand shook, the metal barrel of the gun clicking against Aaron's jawbone. "Read it in a report. Shrapnel to the neck." "Administrative error," Naraly said, keeping her eyes locked on his. She didn't look at the gun. She looked at his pale, sweating forehead. "They discharged me, sent me back stateside with a pat on the back and a prescription for Ambien." "Put the gun down, Elias. He's a civilian. He doesn't even like the sight of blood." "He's a shield," Elias grunted, his grip tightening. "The cops outside. They're going to finish the job. I got ambushed, Naraly. A bad deal. My own people." "I don't care about your deal," Naraly snapped, her tone suddenly harsh, slicing through the panicked atmosphere of the room. Aaron flinched, whimpering, as the gun dug deeper. "I care that you're bleeding out on my floor. You have a sucking chest wound, Elias. I can hear it from here. Your left femoral is grazed, maybe nicked, given the pool at your boots. You have about 4 minutes before you go into irreversible hypovolemic shock." Elias laughed, a horrible, bubbling sound. Always the romantic. The butcher of Kandahar. "Remember when you took Miller's arm off with a Leatherman tool because we didn't have a saw? No anesthetics. Just you, telling him to bite down on a belt." "I remember he lived," Naraly said coldly. She took a step forward. "Don't move," Elias barked, his finger tightening on the trigger. Naraly ignored him. She took another step, then another. She walked right up to the barrel of the gun. She could smell the iron-rich rot of his wounds, the sourness of his breath. She reached out, her bare hand wrapping around the hot steel of the Glock. Aaron sobbed, squeezing his eyes shut. "You're not going to shoot me, Elias," Naraly said softly, dropping the harshness. "And you're not going to shoot him, because if you do, the cops come in and you die. If you shoot me, you die. I am the only person in this godforsaken building who knows how to keep you alive right now. Let him go." Elias stared at her. His eyes were clouding over, the edges of his vision narrowing as his blood pressure plummeted. The myth of the butcher wasn't that she was cruel. The myth was that she was inevitable. In the dust and the screaming of a war zone, Naraly Scott had been the immovable object. Slowly, the tension left Elias's arm. The gun wavered. Naraly yanked the weapon out of his grip, tossing it heavily onto a nearby counter. In the same motion, she grabbed Aaron by the shoulder and shoved him violently out of the way. "Get a crash cart," she screamed at Aaron. who stumbled and fell to his knees. "Don't just sit there. Aaron, move." Elias's knees buckled. Without Aaron to hold him up, he collapsed forward. Naraly caught him, absorbing his massive dead weight. She grunted, her boots sliding on the bloody linoleum as she dragged him toward the trauma bed. "Clara!" Naraly roared toward the door. "Get in here! We need O-negative, rapid infuser, and a thoracotomy tray." The doors banged open. Clara rushed in, her face paper white but her hands moving instinctively toward the supply cabinets. Aaron pulled himself up using the edge of a counter, his chest heaving, his expensive glasses hanging askew from one ear. Naraly heaved Elias onto the bed. She didn't bother with shears this time. She grabbed a scalpel and sliced straight down the center of his tactical vest, tearing the Kevlar away to expose his chest. It was a mess. 2 bullet holes clustered on the right side, bubbling with pink froth every time he tried to take a breath. Tension pneumothorax. Again. But this was worse than the kid from the factory. "Aaron, I need you on the femoral artery," Naraly commanded, her hands already flying over Elias's chest, sealing the holes with Asherman chest seals. "Hold pressure. If he bleeds out from the leg, my chest tubes won't matter." Aaron didn't move. He was staring at the blood on his hands. He had a gun. He was going to kill me. He didn't. "Now put your hands on the wound or he dies right now." Naraly's voice cracked like a whip. Aaron jolted out of his shock. He stumbled to the side of the bed, pressing his hands hard into the torn flesh of Elias's thigh. Elias grabbed Naraly's wrist. His grip was surprisingly strong. "Naraly," he choked out. Don't let them put me in a cage." "Shut up and let me work," she muttered, grabbing the betadine. "I'm serious," Elias coughed. A thick stream of blood ran down his chin. "I'm not going to a cell. Let me go. I am a nurse. Elias. I fix the plumbing. What happens after you leave my ER is not my problem." Monitors screamed. Clara hung the second bag of O-negative blood, squeezing it manually to force it into Elias's collapsing veins faster. The room was a whirlwind of motion, but to Naraly, it felt perfectly, terrifyingly still. This was the only place she ever felt quiet. The chaos of a dying body drowned out the rattling of the fluorescent lights. "Pressure is 70/40 and dropping," Clara called out, her voice shaky. "Heart rate is 160. "He's bleeding internally," Naraly said, her fingers probing the rigid distension of his abdomen. "Bullet must have ricocheted down through the diaphragm into the liver. We need a trauma surgeon down here right now." "Surgeons won't clear the floor until the police give the all clear," Aaron said, his voice straining as he leaned his weight into Elias's leg. "The cops think there might be a second shooter. The hospital is locked down." Naraly cursed loudly. She looked at Elias's face. The gray was turning to blue. His breathing was agonizingly shallow, the chest seals flapping with useless effort. "We crack his chest," Naraly said, turning to the surgical tray Clara had brought in. Aaron's head snapped up. "No, absolutely not. An ED thoracotomy without a surgeon present? It's completely outside our scope of practice. You cross-clamp that aorta, you're practicing surgery without a license. It's murder. He is dying in front of you, Aaron." Naraly grabbed the heavy rib spreaders from the metal tray. "If we don't clamp the descending aorta to keep the blood in his heart and brain, he will arrest in 2 minutes. Do you want to watch him die, or do you want to try?" "I won't let you," Aaron said, his voice trembling but suddenly firm. "You've gone too far today, Naraly. The closed reduction, the needle decompression. This is a line. I am the attending. I say we push pressors, continue fluids, and wait for surgery. Pressors will just squeeze the blood out of his liver faster," Naraly growled. "You know that." "I know the law." Naraly stared at Aaron. For the first time all night, she felt a profound, crushing exhaustion. It wasn't the physical toll of the 12-hour shift. It was the absolute, crushing weight of fighting a system that preferred a polite death over a messy survival. She looked down at Elias. His eyes were half open, fixed on the ceiling. He wasn't tracking anymore. His hand, which had been gripping her wrist, went slack, sliding off the edge of the gurney to dangle over the floor. The monitor shifted from a rapid, frantic beep to a slower, uneven thud. V-fib. His heart was quivering, failing to pump. Naraly looked at the scalpel in her hand. She could do it. She could push Aaron aside, slice open the ribs, crank the spreaders, and plunge her hands into the hot, slick cavity of his chest to pinch the aorta. She had done it in a dirt trench, with artillery shells shaking the ground. She could do it in a sterile room. But as she looked at Aaron's terrified, rigid face, she realized something cold and awful. She wasn't in Kandahar anymore. There was no commanding officer who would look the other way, because survival was the only metric that mattered. If she cut Elias open and he died anyway, which he almost certainly would, given the liver damage, Aaron would testify against her. She would go to prison. For the first time in her life, the butcher hesitated. The monitor flatlined. A long, solid, unending tone filled Bay 4. Clara gasped. Aaron let out a shaky breath, his hands still pressed into the dead man's leg. Naraly stood frozen, the scalpel hovering inches from Elias's chest. The hesitation had cost her the window. He was gone. Time of death, Aaron said softly, glancing at the wall clock. 2:43 a.m. Naraly slowly lowered the scalpel, placing it gently back onto the metal tray. It made a soft clink. She stared at Elias's face. She didn't feel grief, not exactly. She felt a hollow, echoing emptiness. The kind of emptiness that came from knowing you, compromised, the only principle you had left. Step away from the table, Naraly, Aaron said. His voice was no longer panicky. It was quiet, authoritative, and utterly cold. You did everything within the legal protocols. Naraly peeled off her bloody gloves. They snapped loudly in the quiet room. She threw them into the biohazard bin. She didn't look at Aaron, nor did she look at Clara. She walked to the sink, turned on the tap, and began to scrub her hands. The water ran pink, then clear. The heavy glass doors swung open, and 3 armed police officers finally rushed into the room, their weapons sweeping the corners before lowering when they saw the body on the table. "Area is secure," one of the cops barked into his radio. "Suspect is deceased." An officer approached Aaron, throwing a blanket over his shoulders. "Are you all right, Doc?" We heard shouting. Aaron pulled the blanket tight. "I'm fine. The nurse and I. We did everything we could. But the injuries were too severe." Naraly dried her hands with a rough paper towel. She threw it in the trash and walked toward the door. "Where are you going, Scott?" Aaron called out, his voice tinged with a complex mix of guilt and relief. "The police will need a statement." Naraly paused at the doorway. The rattling hum of the fluorescent lights in the main hallway hit her again, a familiar, grating vibration behind her eyes. "Tell them whatever you want, Aaron," Naraly said, her voice devoid of emotion. "My shift ended 10 minutes ago." She pushed through the doors and walked down the long, bright corridor. She didn't look back. She passed the central nurses' station, past the chaotic waiting room filled with coughing children and exhausted parents, and pushed through the heavy exit doors into the cool, damp night air. The city smelled of wet asphalt and exhaust fumes. It was an ugly, gritty smell, but it was honest. Naraly reached into her scrub pocket, pulled out a crushed pack of cigarettes, and lit one. She took a long drag, the smoke burning her lungs, grounding her in the raw, messy reality of being alive. She wasn't a hero. She was just a mechanic who fixed broken things. And tonight, she realized some things were just too broken to fix. If Naraly's raw, unapologetic fight for survival in the ER left your heart pounding, don't scroll away just yet. The medical world is full of hidden battles, silent sacrifices, and secrets that refuse to stay buried. Did Naraly make the right call by hesitating, or did the system finally break the butcher of Kandahar? Drop your thoughts in the comments below. Hit that like button. Share this story with someone who loves gritty medical dramas. And subscribe for more intense, unforgettable narratives.
Hi, My name is Jeffrey Williams, the owner and manager of Second Embury Born. After watching the video, her methods shocked the entire, then her secret past came out. I'd really like to know what you think. How did this story make you feel? What stayed with me most was the tension between experience and rules. Naraly wasn't trying to prove anything. She was focused on saving lives in the only way she knew how. As the story unfolded, it became clear that her unusual decisions were shaped by a past filled with difficult choices and high-pressure situations. Have you ever changed your opinion about someone after learning more about their background? And which moment in Naraly's journey stood out to you the most? In everyday life, maybe it's as a reminder to be a little slower to judge and a little more willing to understand where people are coming from. If this story meant something to you, I'd love to hear your thoughts in the comments. And if you enjoy these nurse-centered stories, feel free to like or subscribe for more.